I'm Shelby Lazarow. I'm a health psychologist, which means I specialize in working with people with different chronic and acute medical issues. And currently, I'm treating patients in Stanford's neuropsychiatry clinic. And so, as many of my colleagues have emphasized, long COVID can significantly disrupt a person's daily functioning and really their overall quality of life. And so in my section today, I'm really going to focus on the psychological symptoms that are commonly reported in this population, and then go over suggestions on how to kind of more effectively help people to cope and mitigate any lasting negative effects of these struggles. And I have no disclosures. And so first, this is just kind of a list of the things that really show up or most reported in this population. First, anxiety and depression are markedly elevated in this population, and prevalence estimates vary, but studies suggest anxiety affects about 23 to 48% of individuals with long COVID, while depression affects about 17 to 48%. And these rates are substantially higher than individuals without long COVID and individuals who have also fully recovered from COVID, as Dr. Presswood had mentioned. Sleep disturbances are another major concern. So insomnia in particular is very common, with patients reporting poor sleep quality, difficulty falling or staying asleep, excessive daytime fatigue. And importantly, these sleep issues are often really closely linked with anxiety and depression, kind of each reinforcing the other. And for those interested in this topic further, I encourage you to kind of review the previous webinar sections that specifically looked at sleep and long COVID, which were great. And then cognitive impairments, which are commonly described as brain fog, as has been mentioned a lot, are also really widely reported. And these include difficulties with memory, attention, and slowed cognitive processing. And although prevalence estimates really vary, as you can see here, the symptom cluster really is consistently cited by a large number of patients in a majority of studies. And then just lastly, post-traumatic stress symptoms are observed in some individuals, and these might include intrusive thoughts, emotional numbing, hypervigilance, and avoidance behaviors. And these are patterns that are pretty similar to those seen in following ICU stays or severe infection. And so just before we get into the coping strategies for the psychological effects of long COVID, I just wanted to take a moment to really emphasize how psychological distress can directly impact physical health and recovery. And this connection is important for everyone, but it's especially important and relevant and potentially high stakes for those dealing with chronic medical conditions like long COVID. And so we know from fields like psychoneuroimmunology that psychological stress can lead to real physiological changes across our nervous systems, endocrine and immune systems. And research shows that psychological stress really increases susceptibility to everything from the common cold to, autoimmune flare-ups. And our immune functioning is really closely tied to our emotional and psychological states. And it's interesting that it's been shown that it's not just the presence of stress for people, but it's how we perceive and then respond to that stress that really actually determines its effect on the body. So leaving a lot of room for intervention to be able to affect how things actually show up in our bodies. And then, epigenetics adds another layer, really demonstrating how our experiences, our behaviors, and even our mindset can influence which genes are turned on or turned off. And this really has implications for people who have the ability to affect disease susceptibility and progression even. And then just finally, chronic stress is also linked to accelerated aging through its impact on telomere length, which I won't get into too much here, but it's also been shown in turn to be associated with increased risk of chronic illness. So I kind of threw a lot out there, but in short, I'm really just trying to get across that psychological distress doesn't just affect how people feel. It can deeply influence how our body functions and how it recovers or doesn't, which is so important to discuss when we're talking about how individuals may really benefit from focusing on how to effectively cope with psychological symptoms. And so, as you can imagine, the combination of physical symptoms, functional limitations, uncertainty that really comes with long COVID, possibly trauma, as I mentioned, you can imagine how it can really profoundly impact a person's psychological well-being. And as I mentioned, even their physical health. And so we're talking about changes that touch nearly every aspect of life, as Dr. Presswood had mentioned, quality of life, daily functioning, identity, relationships. And there's often just such a significant amount of constant worry about the future or ruminating on what happened in the past. And while long COVID is a relatively new condition, the psychological challenges that many patients report are not necessarily unique. They resemble what we've seen in other chronic illnesses, most similar to conditions like chronic fatigue, fibromyalgia, chronic pain syndromes, and autoimmune diseases. And that means we don't have to really reinvent the wheel necessarily. There's a strong foundation of evidence-based strategies that we can draw from when considering helping individuals dealing with long COVID. And I'll get into some of those now. And so individual psychotherapy plays a key role here in helping individuals to reflect on and more adaptively cope with the challenges of long COVID and any associated challenges. And so cognitive behavioral therapy is currently the most studied approach shown to be helpful for individuals with long COVID. And then some other modalities that are less studied, but also shown to be very effective in working with this population are mindfulness-based interventions, acceptance and commitment therapy, trauma-focused treatments, as well as sleep-focused treatments. And these individual modalities have all been shown in the literature to have a positive effect on psychological presentation, as well as some studies showing positive effects on physical symptoms of long COVID as well. And as I've alluded to, more research will be important for all of these modalities. And then there are also other modalities that have been much less or not studied yet in terms of the long COVID population directly, but which are worth considering due to their effectiveness in populations dealing with other chronic illnesses. And these are supportive modalities of psychodynamic psychotherapy, compassion-focused therapy, positive affect interventions, which are often coupled with some of the previously mentioned modalities. And then things like motivational interviewing can also be valuable, especially when individuals may feel overwhelmed or really ambivalent about changes they might have to make. And as with other populations that deal with things like fatigue or mobility limitations, being able to offer these things in person or online can significantly improve access and retention in therapy. And then group therapy is another incredibly effective option. Within the long COVID population, group therapy has been shown to really help reduce anxiety, depression, and loneliness, while also helping people to really feel less ashamed often of their experience and kind of normalize this experience. And these groups are either support style or often they're skills-based so that people can learn kind of more concrete tools for coping, like pacing, emotional regulation, acceptance, communication strategies, or increasing agency. And groups are also able to be offered, like individual therapy, both online or in person or hybrid formats that can make them much more accessible and also cost effective and catch more people. And literature on group interventions are pretty minimal for this population, but what does exist and drawing from group therapy within other chronic illness populations, there's a lot of support for the use of, cognitive behavioral therapy, mindfulness-based interventions, and ACT groups. And I'm actually, and as I'm continually acknowledging, more study needs to be done to kind of start to identify which maybe specific therapeutic approaches and group structures yield the best outcomes. And I'm currently now at Stanford running a mindfulness group for individuals with long COVID, and we'll be starting a more support style group as well. And so it's also important to recognize the ripple effect long COVID has on families and relationships. And while specific research on couples and family therapy for long COVID is really still developing, early studies and decades of work in chronic illness and post-viral conditions really highlight the importance of addressing these relational dynamics, because long COVID often brings really significant changes in roles for people, particularly when, say, a partner or family member is taking on a caregiving role. And so we know from broader chronic illness research that family dynamics can really greatly influence how someone's able to cope or even recover. And so when we support not just the individual, but also their close relationships, outcomes tend to improve both psychologically and relationally. And so family and couples therapy can really offer partners and families a space to better communicate, reduce conflict, and foster stronger support systems for these patients. And so, as I'm mentioning, maybe there's not that much research at this point, but it's pretty clear from the presentations and the issues that come up with long COVID and other chronic illness research that the case for supporting the family as well is really important. And I just quickly want to touch on just and acknowledge other interventions that might also play a role are things like cognitive rehab for brain fog, biofeedback for more self-regulation strategies, caregiver support, psychiatry or medication interventions, physical therapy, nutritional support, and even community groups. All of these can really contribute to better functioning and resilience. And so just to reiterate, just like many other chronically ill patient populations, individuals dealing with long COVID present with substantial and persistent psychological distress, which can have a really great effect on daily functioning and physical health and ability to recover. And so although this is a less studied population, its presentation really overlaps a lot with more studied chronically ill populations, which has provided a great framework for effective treatments and supports, such as the ones that are presented here. And just one last thing that I kind of want to acknowledge is I really want to emphasize the importance of multidisciplinary teams and integrated approaches in the care of these patients. Because as you can see from the many different disciplines presenting in this webinar series, these patients are being seen by multiple providers, and being able to help bridge the gap between specialties and coordinating care and sharing information can make such a huge difference in the experience of the patient and also the outcome of care. And so that's about it for me. So I'll pause there and pass it on to our next presenter.